My name is Judith Jones, and I'll be discussing informed consent. In the journal article, How to Strengthen Patients' Meaning Response by an Ethical Informed Consent in Psychotherapy, Traxel and Holtforth, 2019, it is stated that informed consent provides the major legal and moral legitimation for physical medicine as well as psychological interventions, including psychotherapy, independent of the setting, be it inpatient or outpatient, individual, couples, or group therapy. American Psychiatric Association, 1998, Beauchamp and Childress, 2013, Traxel et al., 2015. For that reason, informed consent is a necessary prerequisite and a moral duty reflecting the individual's right to self-determination, moral principles, respect for autonomy, dignity, patient well-being and protection, moral principle, beneficence, as well as doing no harm, moral principle, non-maleficence. By meeting all those moral values, informed consent has been named a central element of patient-centered care and a contribution in the JAMA Krumholz 2010. Patient-centered care has been named as one of the 6 core attributes of a high-quality healthcare system by the Institute of Medicine Committee on Quality of Healthcare in America, is defined as providing care that is respectful of and responsive to individual patients' preferences, needs, and values, and ensuring that patient values guide all clinical decisions. IOM 2001. I reviewed the informed consent document for Dr. Robin Lowy and Associates here in Pennsylvania. They have an office here in Philadelphia, and they also have an office in Jenkintown. In line with the American Counseling Association 2014 and the Pennsylvania Code, Chapter 49 of the State Board of Social Workers and Family Therapists and Professional Counselors, Licensure of Professional Counselors, 2002, the informed consent document outlines the evaluation process, as well as the benefits and risks of counseling, the minimum recommended frequency and length of counseling services and sessions in order for the therapy to be most effective, fees, billing, and payments, what happens if payments are not made, and how services can be terminated if payments are not being made. It also outlines the insurance reimbursement and what information can be shared with the insurance company according to the Health Insurance Portability and Accountability Act of 1996. It also outlines confidentiality and the confidentiality limits. The form is easily understood by a person of reasonable intelligence, and a signature is required. The ACA Code of Ethics of 2014 states that clients should be informed of their right to enter into counseling services and their right to terminate counseling services at will. This form does not include these disclosures for clients. It also does not include, as outlined by the American Counseling Association Code of Ethics and the PA Code, which informs the client of what steps can be taken if he or she cannot read or understand the form. It also does not talk about the limitations of electronic services. A comprehensive informed consent is an ethical and moral obligation for counselors necessary to uphold the dignity of the profession and the autonomy of the client.